You know the feeling, right? That itch, the sneeze, the watery eyes. Yep, that's histamine at work. But what if I told you that exact same little molecule is also the one churning out stomach acid? Seriously, it's a chemical with two completely different and super powerful jobs in our body. So let's dive in and figure out how that's even possible. So, what on earth links the misery of seasonal allergies to something like stomach acid? I mean, it sounds like a trick question, doesn't it? But the answer is actually pretty straightforward. It all comes down to one single powerful molecule: histamine. Okay, but before we talk about how to block it, we really need to understand what we're dealing with. Think of histamine as your body's own internal alarm system. It's designed to be incredibly sensitive and, sound the alarm at the very first sign of trouble. So what is histamine? Well, at its heart, it's just a small molecule made from an amino acid. But its real power? That comes from where it's stored. It's packed away inside these special immune cells, we're talking mast cells and basophils, which act like tiny little chemical guards stationed right where we need them most: our skin, our lungs, and our gut. So how does that alarm get triggered? Well, with an allergic reaction, it's a pretty clever setup. The very first time you run into something like pollen, your body doesn't freak out. It just prepares. It makes these specific antibodies that latch onto those mast cell guards. Then, the next time that same pollen shows up, it binds directly to those antibodies, and boom, that's the trigger. The mast cell just bursts open, releasing a whole flood of histamine. And it's not just allergies that set this off. A simple cut or scrape can physically damage those mast cells, making them spill histamine everywhere. And get this, certain drugs or even things like bee venom can chemically force the histamine out directly, completely skipping the whole immune system pathway. All right, so histamine is out and about. Now what? Well, what happens next depends entirely on where it lands. Histamine is kind of like a key, and its effects are all about which lock or which receptor it fits into. We're going to focus on the two big ones, H1 and H2. And this is really where you see the split personality of histamine. When it locks into an H1 receptor, you get all those classic allergy symptoms we know and, well, don't love. Leaky blood vessels that cause redness and swelling, constricted airways making it harder to breathe, that annoying itch, and even pain. It's even what helps keep you awake in your brain. But when that same molecule finds an H2 receptor, which is mostly in your stomach lining, it does just one thing. It cranks up the production of stomach acid. So it's pretty clear, right? If we want to stop allergies in their tracks, our target is that H1 receptor. And this is exactly where the drugs we all just call antihistamines come into the picture. Now, here's a really cool little bit of pharmacology for you. These drugs aren't just blockers in the simple sense. They're technically called inverse agonists. What they do is find that H1 receptor and basically lock it into its off position. They stabilize it so that histamine can't come along and activate it. And that is how they stop the itching, the sneezing, and the whole runny nose situation. But here's the thing, not all H1 blockers are created equal. The biggest difference between the older first-generation drugs and the newer second-generation ones comes down to their chemical structure. See, the older drugs are what we call lipophilic, meaning they're fat-soluble. They can just slip right across the blood-brain barrier, no problem. The newer ones, they can't. And that one single difference, well, it changes everything. Right, because those older first-gen drugs get into your brain, they block the H1 receptors that help keep you awake. This is exactly why a drug like diphenhydramine, you probably know it as Benadryl, makes you so incredibly drowsy. They're also not very picky, which leads to side effects like dry mouth. But here's the clever part. Doctors has turned these bugs into features. They use that sleepiness to treat insomnia and the anti-nausea effect to help with motion sickness. Now, the second-generation drugs, your cetirizines and loratadines, were specifically designed to stay out of the brain. They're way more selective, targeting only the H1 receptors out in the body that are causing your allergy symptoms. This is a brilliant piece of modern drug design, really. You get all the allergy relief, but without the drowsiness. It's why you can take a Zyrtec or a Claritin and still go about your day, while taking a Benadryl might make you feel like you need a nap, like right now. Okay, let's switch gears completely. We've handled the sneezing and the itching, but what about that other job histamine has? To deal with the H2 receptors, we need a totally different class of drugs. These have nothing to do with allergies and everything to do with calming down stomach acid. So it all starts in the lining of your stomach, inside these specialized cells called parietal cells. When histamine shows up and binds to the H2 receptors on their surface, it's just like flipping a switch. And flipping that switch turns on a tiny little machine called the gastric proton pump. Its one and only job is to pump hydrogen ions, which is really just a fancy name for acid, out of the cell and into your stomach. So the solution here is just beautifully simple. H2 blockers are designed to fit perfectly into that H2 receptor, physically blocking histamine from ever getting there. No signal means the proton pump never gets the message to turn on. And just like that, acid production drops way down. This is what makes drugs like famotidine so incredibly useful for treating things like GERD and stomach ulcers. And for the most part, they're really well tolerated. Now, some older drugs in this class, like ranitidine, have been recalled for other reasons, but many are still very safe. The one to know about is cimetidine. It's known for having more side effects and drug interactions, so you just don't see it prescribed as often these days. All right, let's pull all of this together and look at the big picture. We've seen how this one little molecule, histamine, can cause two totally different sets of problems, all depending on exactly where it's acting in the body. And really, it all boils down to this. Two different problems, two very specific targets. If the issue is allergies, itching, and sneezing, you block the H1 receptor. If the problem is too much stomach acid, you block the H2 receptor. It's just a perfect example of how modern pharmacology can create these incredibly targeted solutions for what seem like unrelated issues. So, we end right back where we started. One simple molecule causing two distinct problems, which require two completely different solutions. It really makes you wonder, doesn't it? What other common molecules in our bodies are playing these kinds of complex double-agent roles?